Hello, my name is Dr. Jamuna, and I'm a pharmacist and a lecturer at the School of Pharmacy, Monash University Malaysia. Today's episode 5, Tobacco Use and Oral Care session, will provide some insights on how pharmacists support cessation and promote good oral hygiene. By the end of this session, you'll be able to understand the connection between tobacco use and oral health, including key signs, symptoms, severity, disease progression, and broader health implications. And you'll be able to identify effective strategies for pharmacists to support patients in improving their oral health, reducing tobacco use, and engaging in interprofessional collaboration to prevent or manage clinical complications. You'll also be able to identify red flag symptoms associated with tobacco-related oral conditions that require referral to dental and medical health professionals. And you'll be able to apply evidence-based recommendations to help manage tobacco-related oral health conditions, including self-care strategies that pharmacists can provide to patients. Let's take a look at how tobacco use affects oral health. First, smoking causes dry mouth, which creates the perfect environment for persistent bad breath, something that can be both uncomfortable and socially embarrassing. Next, many people notice tooth discoloration. Tobacco doesn't just stain your natural teeth. It also affects fillings, crowns, and even dentures, leaving them yellow or brown over time. Tobacco also weakens the body's ability to heal. After procedures like tooth extractions or oral surgery, smokers often take longer to recover, and the risk of complications is higher. In fact, smokers are also at a higher risk of developing cavities due to the way tobacco changes the mouth's bacterial environment. Some may also develop what's called smoker's melanosis, where the gums become darkened or discolored. The good news, this often fades within 3 months after quitting. Dental implants are another concern. Smokers are more than twice as likely to experience implant failure compared to non-smokers. And it's not just the smoker who's at risk. Children exposed to secondhand smoke are also more likely to develop cavities. In episode 2, we explored the pathophysiology of periodontitis and how it's connected to systemic health. Just to recap, periodontitis is a severe gum infection that damages the tissue and bone supporting the health. If left untreated, it can lead to premature tooth loss. Now, I'll be talking about how tobacco use makes this condition much worse. Here are some important facts. Around 70% of tobacco users are affected by gum disease. Smokers are up to 4 times more likely to develop periodontitis compared to non-smokers. And smoking actually doubles the risk of tooth loss. One tricky thing is that smoking reduces inflammation in the gums. That might sound like a good thing, but it actually masks the warning signs like bleeding and redness, which can delay diagnosis and treatment. The good news is quitting smoking can significantly improve gum health. It also boosts the success of gum disease treatments and helps protect your remaining teeth and bone structure. Oral potentially malignant disorders, OPMD, and tobacco use. Here are some facts about OPMD. OPMD refers to conditions that could turn into cancer. High-risk OPMD conditions include leukoplakia and oral lichen planus. The global prevalence of oral leukoplakia is estimated to be 3%. It is more common in Southeast Asia and less common in Western countries. Smokers and bitter quid users have a higher risk of developing these conditions. Now let's talk about one of the most serious consequences of tobacco use, oral cancer. Oral cancer rates may be decreasing in some regions, but they remain alarmingly high in countries like Sri Lanka, India, China, and parts of Europe. And while the risk increases with age, we are also seeing a rise in younger people being diagnosed in certain countries. Tobacco, whether smoked or chewed, is a major risk factor. This includes not just cigarettes, but also smokeless products like areca nut and tobacco mixtures. Here are some facts. Smokers are up to 10 times more likely to develop oral cancer compared to non-smokers. Smokeless tobacco users face a 5 times higher risk. However, after just 5 years of quitting tobacco, your risk of developing oral cancer drops by half. The common sites for oral cancer include the tongue, floor of the mouth, inside of the cheek, and the lower lip. Some signs to watch out for include white or red patches inside the mouth, a lump or sore that doesn't heal, pain or difficulty when moving the tongue or jaw. When it comes to identifying and supporting patients who use tobacco, ask, look, decide approach can go a long way. First, ask. Start the conversation by asking clear, respectful questions. Do you smoke cigarettes? Do you use any tobacco products, such as smokeless tobacco? How long have you been smoking or using tobacco? On average, how much do you use in a day? At what age did you first start using tobacco products? These questions help us understand the extent of tobacco use and open the door to further conversation. Next, look. In countries where pharmacists are trained and allowed to conduct basic oral health checks, do a quick oral examination. Be alert for signs of oral cancer or precancerous conditions, advanced cavities, or signs of chronic oral infections, and common signs of tobacco use, such as tooth staining, bad breath, yellow stained fingers, chronic cough, a raspy voice, or a tobacco odor on clothing. Finally, decide. Use your findings to determine what level of care is needed. Ask yourself, is there a life-threatening condition like suspected oral cancer? Are there signs of severe decay or infection that need urgent care? Or would a simple lifestyle change and follow-up would be enough for now? If needed, refer the patient to a dental or medical professional for further evaluation. Education is one of our most powerful tools in tobacco prevention and cessation. Children and adults alike should be educated by healthcare professionals, not just about the general risk of tobacco use, but also how it can directly impact their oral and overall health. Pregnant women, in particular, need clear and supportive information about the harmful effects tobacco can have on both their own health and the development of their baby. This includes increased risk of premature birth, low birth weight, and complications during pregnancy. Sometimes, seeing is believing. Showing patients visible effects like stained teeth, gum disease, or oral lesions can make the consequences of smoking feel more real and personal. Paired with other educational tools, these visual cues can be powerful motivators to quit. Early identification of tobacco users enables timely intervention. The most effective cessation approach combines counseling and pharmacotherapy to address both mental and physical addiction. Counseling offers strategies to manage cravings and support long-term quitting, while medications like NRT, bupropion, or varenicline help reduce withdrawal symptoms. Pharmacists play a key role in raising awareness and supporting patients, and interprofessional collaboration ensures effective management of tobacco-related oral health issues. Some lifestyle modifications and oral care habits can support better oral health, especially for those using or quitting tobacco. Encourage dietary modifications and lifestyle changes. Encourage a reduction in sugary and acidic food and drink to help prevent tooth decay. Tip: advise eating sweet foods or treats as part of a meal rather than between meals. Regarding dental care, educate and motivate the patients on oral hygiene measures. Patients can come to the pharmacy for occasional basic oral health examinations. Frequency of dental visits, ideally twice a year, even without apparent oral or dental issues. Encourage patients to practice good flossing and brushing habits. Brushing should happen at least twice a day for 2 minutes, including the last thing before going to bed. They should check the label of the toothpaste to ensure it has the correct amount of fluoride, 1350 to 1500 ppm for an adult. Dental floss and/or interdental cleaners to prevent gum disease. Use tongue scraper or cleaner to prevent halitosis, bad breath. Tobacco use significantly harms oral health by damaging tissues and leading to gum disease, pain, tooth loss, and even oral cancer. Secondhand smoke also contributes to these negative effects. Pharmacists play a vital role in addressing this issue by raising awareness, educating patients, and encouraging tobacco cessation. Managing and preventing tobacco-related oral health problems also requires strong interprofessional collaboration. When healthcare teams work together and promote consistent cessation messaging, patient outcomes improve and support for quitting becomes more effective. Thank you.